We often hear about families' struggles to pay for affordable childcare, but less attention is paid to the cost of caring for parents and older loved ones. More than 9 million Americans rely on help at home for daily activities. An estimated 35 million caregivers provide much of that care, and they are not paid for it. To help us understand the cost that adult care is having on families and our economy, we are joined by Dr. Rachel Werner, a professor of medicine at the University of Pennsylvania and an expert in the economics of healthcare. Welcome, Dr. Werner. We appreciate your time.
Thank you. Nice to be here.
So let's start with this. How common, how often is it that health insurance doesn't cover the cost of in-home caregiving for our parents or for older adults?
It is quite common. There is no public long-term care funding in this country. And although Medicaid pays for the majority of long-term care, you have to be either low income or have very few or low assets to qualify. So most Americans end up having to pay for health care out of pocket. And that can be quite expensive. For the average person over the age of 65, they'll spend about $120,000 on paid care for long-term care.
That number is a huge number. How does this look? How do we see this financial burden playing out in a lot of these families?
So most people can't afford that, as you might guess. And so what happens is the entire middle class of this country can't really pay that. And what they do instead is rely on friends and relatives to provide unpaid caregiving. And so that's usually, as I said, a family member. And if you try to monetize the amount of care that is given through unpaid caregiving, it's about $100,000 per person who needs long-term care.
For those of us who are not in that position yet, taking care of a senior or a parent, why should we care about this? What is the impact to our economy?
Well, what I can tell you is that caregiving is incredibly common. About 1 in 5 people care for an older adult. And it's really costly to the caregivers. They not only lose wages when they're caring for their relative, they also lose long-term benefits, including health benefits, pensions, Social Security, retirement benefits. The total economic losses to an individual caregiver averages between $300,000 and $600,000. On top of that, there's physical and mental health consequences to caregiving. And so I think we should care about this because our friends and relatives are the people who are providing this care. And we may be ourselves as our parents and our loved ones age. And it's really costly to the entire society.
So essentially, you're saying that a lot of folks someone in the family is essentially having to step away from their jobs to take care of this loved one. Okay.
Yes.
So let me play devil's advocate a moment. Traditionally, decades, hundreds of years ago, folks took care of the elders in their home. So I ask, some people may say, well, why is today any different? Like, what has changed that we should be so concerned about this?
Well, so I think that in the United States, we don't live in a country that values older adults as they age. There are a lot of countries where it is true that families are responsible for caring for their older adults. But in this country, most parents don't necessarily live geographically close to their children. Many don't. Children often work full-time jobs, as I said, and so have to step away in order to be able to provide this care. And we just don't live in a society that values caring for older adults the way we do, for example, caring for children. Policy conversations about how to pay for childcare are quite common, but we rarely talk about how to pay for elder care in this country.
Certainly, we'll be watching this issue. Dr. Werner, thank you so much for your time. We appreciate you joining us.
Yeah, thank you very much for having me.
Thank you. Thanks for watching. We've got more great content for you, from news to the arts to the environment. So be sure to like and subscribe to WGCU's YouTube channel and follow us on our social media platforms for the stories that matter to you.